All right, I'd like to welcome everybody to the March meeting of the Medicaid Client Voice Council. I am Deputy Chief of Community Engagement Jason Peterson. We have members, we are a statewide council, so we have members coming from all corners of the state. We've got a couple members who have notified me. They're coming from Rogers and DeQueen. They're on their way. They'll be here shortly. But we're going to get started. We have an agenda, and we have a lot of happenings behind the scenes that you guys aren't privy to, but DHS is preparing to host the governor for a press conference this afternoon. That got thrown on the schedule recently, and so we're juggling that. And so we may juggle the order of our agenda a little bit today, but we're gonna address everything that was on the agenda that was sent out to you. A couple reminders: fill out your mileage reimbursement forms before you leave and leave them on your table with your packet so that you can be properly compensated for the distances that you traveled here today. Also, for purposes of our audience that are watching online, and we do have people who are watching online, if you have something to say, whether you're leadership or whether you're one of our members, raise your hand and let me bring you a microphone, because while these microphones don't help amplify anything here in the room, if you don't have a microphone in front of you, no one watching at home can hear anything that you're saying. This is for the audience and for the recording that is made available to the public. But when we speak, we need to have a microphone near us so that people at home can hear what we're saying. Also, I'd like you to, the purpose of this council is to present issues and problems and ideas to DHS leadership. The DHS leadership, I want you all to envision them as a bridge to the change that you hope to effect. They're not a wall or an obstacle, they're a bridge. They are the people who can affect the change that you want to see. So we can be passionate in the opinions and the ideas and the problems that we present. We also need to be respectful, because we need their cooperation to get the change that you want to see happen. So just keep that in mind as we go into especially the open discussion comment portion of the meeting. Keep that in mind, and because we all want to see a better DHS work to serve the citizenry of Arkansas. So we have a couple new members that are here today. I'm going to wait until the second part of the meeting for them to be introduced, because one of them is on her way here. So we will meet two new members. One was a member for the January meeting, just couldn't be here in attendance, but one is a brand new member, replacing Erica Buenrostro on the council. So we'll meet them in the second half of the meeting after lunch. They'll get their pictures taken, just as all of you have. But before we begin, I'd like to see if our chairperson, Jerry Watson, has any comments that he would like to share before we open up the meeting with our first agenda item.
Give you honor to God. My name is Reverend Jerry Watson. Good morning, everyone. It's good to see you. I'm going to take this mask down. You can hear me better. We represent the poorest state in the United States, Arkansas. And we have some of the highest percentage of people that are using some form of Medicaid, whether it's AR Kids or other programs, regular Medicaid or AR Home or CHIP, and various other programs associated with it. So we have a special purpose dealing with such a high percentage of low-income people. And it's not just the low-income people, the people living in poverty. It's also the people who are low income, because they still qualify for Medicaid or AR Home or other programs. So do the best you can, because you're doing God's work. You're not making a lot of money, but you're doing God's work. Thank you, and God bless you.
All right, thank you, Jerry. Also, I'd like to acknowledge our DHS Secretary, Christy Putnam, here. She worked the room. Hopefully she had a chance to come by and say hello to you, and you can always visit with her during the breaks as well, and all the rest of our DHS leadership that's here. We're going to start the meeting. You guys have learned a lot over the past year about the unwinding of the continuous coverage under the continuous Medicaid coverage during the pandemic, and how that's being unwinded now. Well, the unwinding has ramped up. It's here. We're here. And so the DHS plan for that is in effect. And so you may have some questions about it. You may want an update on it. So we're going to bring up to the podium the Deputy Director of Health and State Medicaid Director, Janet Mann, along with the Director of the Arkansas Medicaid Control Center, Amy Webb. They're going to just give you a brief update on what's going on, where we're at now. And really, we anticipate you're going to have some questions. So this portion of the program may carry us right through to lunch. So without further ado, let me welcome those ladies up, and they'll give you an update, and then we'll open it up for questioning.
I have a question for you, Jason.
Yes.
So this says welcome, we will begin shortly. Does that mean we're online or not online?
We are online.
Okay.
We are up and running. This will change when we have slide presentations. So.
Okay, well, I just thought
Yes.
I'd check because I knew people were online.
Yes.
I have notes and cheat sheets. So how are y'all this morning? Good morning. Janet Mann and Amy. Thought it would just give you some highlights of what's going on with the unwinding, and then open it up to Q&A. And I don't have any slides, but we have the unwinding plan, which is on our website, which we can send out to everyone after the meeting so that y'all can have it. So we began our renewals on February 11th, and that means that we started sending packets to different groups. And those groups were about a quarter of the Our Home category that have been extended, about a quarter of the Our Kids category that have been extended based on the renewal date, a quarter of the parent caretaker category, and everyone else who is not extended but has a regular renewal. So all that to say, we are trying to space out our renewals as carefully as we can to be able to process those timely, but to assist with any questions and answers. And we sent out another packet, another section in March, and then we're starting to get some feedback. And then, would you like to add anything to that?
Yeah, so just a couple things to think about. So I think for February and March, about each month, we sent 115,000 renewals. Not all of those were extended. I think maybe like 75,000 were extended, and the rest were regular renewals that were just due. So we're monitoring those pretty closely. One of the first things I noticed that I felt good about, and I hate even saying good stuff out loud because I'm afraid I'm going to jinx it. But so we've been monitoring returned mail. That's one of the things that we're a little worried about, and we want to make sure that we're making sure people get their packets. So far, for just the last 2 weeks, we have gotten a total of 6,250 pieces of return mail. And I thought it would be higher. So I felt good about that. That is as of last week. We get our return mail report every Wednesday, so I don't have it yet for this week. We do expect that will increase. We know historically that this population does move fairly frequently, or at least a portion of them do. So we expect that to increase. But we are working on a couple of other things related to return mail that I don't think we've told you guys about. We did update it in the plan, but we have to, CMS says that we can't just cut people off if they didn't return, they got a return mail, we can't reach them. So one of the things that we've done to try to address that is we are now texting people if we have an email address, a cell phone number, and we're emailing them if we have an email address. And if they have a Access Arkansas online portal account, we're also issuing a notice through there in an effort to try to reach those people whose mail was returned. So hopefully we'll see good results from that. It's still a little early. We started that in March. And I'm trying to think if there was anything else I wanted to mention on the unwinding. The one other thing that we are doing is, so previously we were not doing ex parte renewals, which means like we would do data matches to try to complete the renewal without ever having to contact the client or beneficiary. We were not doing that on the long-term services and support categories, and now we are. So we're doing ex parte renewals on all of our populations. So hopefully that will help as well.
Those can also be called administrative renewals. So the terminology, depending on the state, can refer to them as ex parte or administrative. But one of our objectives there is to use some of the data and some of our IT resources that we have and connect with other partners to match that information to be able to expedite the process of renewal and redeterminations. So,
Now, I'm just going to add,
Yeah.
so one other thing. So right now, as of yesterday, we have 427,817 Medicaid clients who have been extended. And just as a reminder, those are folks that at some point during the last 3 years were determined ineligible, either because they're no longer income eligible, or they changed categories, or aged out, or didn't respond to us. But that number is going down. We're seeing people go back to regular status. So that's good news. So we want to open it up for questions about the unwinding.
So whoever I took this from can use this.
Oh,
Okay.
okay.
All right. Member Michelle Lappin has a question.
I had two questions. One of them that I had mentioned, I missed last meeting because we were sick, but the meeting before I had talked about people moving from one category of Medicaid to another, the time lapse. Like for instance, for our children, we're probably going to not qualify for the regular Medicaid, but because all three of my kids have disabilities, we would qualify for TEFRA. But the issue that we found when we first got on TEFRA, and then a lot of things happened and we changed categories, was some of those take time to get back in place. And so with TEFRA, now this is when we first applied for it, it took 3 months. So my question was last time, is there going to be a way to make that time shorter? Because for our family, all of my kids are on passes. They're all getting medical services, medical supplies, and we can't go 3 months without all of their stuff when all we're doing is changing over from one Medicaid program to another. And, you know, like we talked about last time, our status hasn't changed as a family of kids with disabilities. Our income or which category we fall in has. So is there effort being made to make that go a little bit faster when you're changing from one category to another so people aren't losing, you know, tons of services in between that switch over?
yes, I'll start and then I'll let Amy fill in if I miss something. So specifically on the TEFRA, with I'll talk to that and then talk about changing of categories of eligibility. Yes, we are trying to streamline the TEFRA application as an overall objective at DHS, because we do know with an annual redetermination and the requirements with TEFRA and medical records, that can be it can be burdensome. So we are looking at that as an overall objective for one piece. The second piece that you asked about with changing of the category of eligibility within the system or doing redetermination and going from one category to the next, that is something that we are trying to monitor our timelines of when renewals occur. That's one of the reasons we've been very conscious of keeping our eligibility staff employed and the numbers up to date, but also adding some surge support with our two contractors, Deloitte and Maximus, to help with that. Then the last resort, unfortunately, is if we do the TEFRA and if we monitor the timelines, then we have the stopgap method of the 90-day retroactive. And I know that doesn't really answer your main question, but I have that as a stopgap at the very end. And then anything else to add, Amy?
So I was checking with Robert. So the way a renewal should work is when your renewal goes out, we will not close it until it is completely processed. So in this case, if you're in ARKIDS, right, and the system says you're not you're not eligible for our kids, but you are for Tefra, then the system should keep you open in our kids, correct? Until that transition can be made, because that is a more complex eligibility process. So it will send you out a packet then that says, okay, you're not available for this, but you're available for Tefra. We need a list of all of these things, and it should keep you open, because our kids is the next category you would be eligible for. So it should keep you open until that is done. That is one thing we'll monitor, though. I will put that to my list of monitoring our kids in Tefra to see those transitions and see if there are any issues that come up.
Who else had a couple over here?
Holloway, did everybody receive the little postcards? Is that what you're saying in categories? Because we got a postcard like way back when, my twins did. But we hadn't I kept looking for a follow-up packet. We ain't got one.
Okay, so I do believe postcards were sent last year, and so I don't want to miss the question. So those were sent last year to update information and make sure everything is still in the system and correct. That's been an outreach. Okay.
Yeah, we sent those to some categories, but not all categories. So they went to like the individuals in Tefra, autism waiver, I think the CES waiver. I think those are the categories that the postcards went to. And then, so what happens now, and I think like Gavin and his team are doing such a great job getting the word out about the renewal packets. People are like, wait, where is my packet? And remember, we had to spread them out. So they're on a schedule over from February through July. All the renewals should go out by the end of
So
July.
I can wait till July to get paperwork.
Yes.
Up to July.
Up to July.
If you don't have something by July, we definitely want
Yes,
to
let
know.
us know.
Did that say that on the postcard by any chance?
I think what the postcard said was renewals are coming.
Yes.
But because the postcards went to a whole bunch of people and their renewals were all at different times, we tried to be generic.
Well, I just
but-
didn't want it to be lost in the mail.
I love that. A lot of people have called to say, hey, where is it? I haven't gotten it.
Okay.
I've heard about it. So,
Thank you for that, for your presentation. And I have a question about churn. Churn has been sort of the goal, eliminating churn. It's sort of been the goal, if I'm not mistaken, during the public health emergency. I think it went down to almost zero compared to what it was before the public health emergency. When did the public health emergency officially begin?
March of 2020. No.
yeah.
So
Yes, I'm
we've
sorry.
had it about 3 years.
Yes, sir.
Okay. And what was the churn rate before the public health emergency, during the public health emergency? And what do you expect it to be afterwards with the new technology that you have now and the new policies?
So I don't know the churn rate prior to the public health emergency, unless you know it.
I
off the
do
t-
not.
But I'm making notes.
Robert, do you know?
Come on,
Say who you are.
Deputy Director of Account Operations. Not exactly the churn rate, but historically about 25% of our population normally don't return their renewal forms, turn information we need. So we know that's a target area we know that we could be looking at. So we don't know if they're going to jump up or decrease during this process. But that's basically the historic data we have on that.
Okay. And for the people that are on different programs within under the Medicaid category, or AR Home or AR Kids or whatnot, how many total people were using Medicaid before the public health emergency, and what was the total maximum total at the height of the public health emergency, and how many do you expect to be using various programs afterwards.
So I think,
It was like 900.
yeah, just go ahead.
So-
Before, I wasn't here before the public
Yeah.
health emergency, so
I
I
know,
don't
I
know.
understand.
attention.
You get a pass, you get a pass.
So I think it was about 960,000 people who were on Medicaid prior
About a
to the
million.
public health emergency. And now we're up to
I think at our highest peak, it was 1.2 million Arkansans were on Medicaid.
Oh, I thought it was 1.3, but mine.
Well, I could be off. I freely, I'm thinking from memory. And then after the public health emergency, we're very cautious. Some of the national estimates say that 15 to 30% of the fee-for-service Medicaid could lose their enrollment. We have not applied that number because we don't know what's going to happen in Arkansas. We want to see the numbers because we've already seen with some of our extended category that Amy was talking about earlier, they've gone from extended to a regular category of eligibility. So they've not lost coverage, they've just changed coverage. So I'm very anxious to see what the disenrollment looks like in April so that we can begin our forecasting to see if that's going to be a trend or not. So hopefully by the next meeting, I will have some hard numbers of what we are seeing for disenrollments. But national estimates are 15 to 30%. And we don't know if we're going to fit in that category somewhere in that range or not until we go through it. And then on our home, we are expecting about 50,000 people to roll off and into a different category, either on the federal marketplace or in Medicaid fee-for-service.
Okay, this is just a comment. You don't
Yes,
have to
sir.
respond if you don't want to, but during the public health emergency, because we are one of the poorest states, and this year we became the poorest state in the country, according to IRS, because of per capita income within the state. You know, we've had a large percentage of the population within the state on various DHS programs associated with Medicaid. About 1/3 of the population, or at least 1/3 of the population normally, but it ballooned up to like 40%, I think, 42%. So we've received a lot of federal dollars. We've received billions and billions of federal dollars because of that, extra federal dollars. And it's created in my opinion, it's created a huge surplus in the state. And then we've taken that surplus and we've spread it out and given it to various entities, but it doesn't seem to be shared as much with the poor. It tends to go to other entities. And I think now we're talking about using it to build more prisons and stuff like that, which is not related to DHS, but I'm just concerned that now that the public health emergency is over with, that large pool of dollars is going to be eliminated, and so many people are going to be wiped out from getting health care. We go from 1.3 million. I'm concerned that we may lose about 500,000 people might lose their benefits or be transitioned off into something that some other entity. Are you concerned about that?
I am concerned about the end of the public health emergency and what it will do to our beneficiaries. I think most of our efforts with the redeterminations one of our biggest goals has been we don't want to create a cliff. We don't want to remove anyone arbitrarily. So we've made some extra steps to try to reach more people that are on the rolls to determine their eligibility and reach them in different modalities. So I think we are trying to make that effort. We will not do it perfectly. I'll be just as transparent as I can be. We are gonna make mistakes during the public health emergency redeterminations. And we are going to learn of those mistakes and we are gonna correct them as quickly as we can. I think it will be a combination of errors. I don't think it will be the bulk of what we do. I think we will redetermine over 1.1, 1.2 million Arkansans in a short time period, and I think the bulk of those will be handled very successfully. We will remove people in error when we learn about that. We will work with our eligibility team across the state to get them requalified, and that's one of the reasons we have the 90-day retroactive period, to try to correct the mistake, but also not harm them with any care or any bills. Then we are going to leave people on Medicaid that are not eligible due to their income, and we're going to have to do some quality control on that check, just to check our processes. And then there could be other mistakes that we haven't identified yet. So it does worry me, because I would like to see us handle this historic event of taking all the Arkansans back through redetermination after a public health emergency and have it be as smooth as possible. I think that's one of our goals. I think it will be a day-by-day that we will pay very close attention to. We have created teams within the division or within the department to monitor it every day at different levels, just because there's a lot to it. And
And I know that she is worried about it, because she told me on Friday, we have to start meeting every single day to talk about this. So I know that she is worried about it and wants to monitor it really closely, and we're committed to doing that.
Yeah, I understand you have a large challenge. Arkansas has been criticized for giving the shortest period of time to transition people off of the public health emergency. I think we have 60 days, I think.
6 months.
no, sir, we have 6 months
6
according to the
months.
statute that was passed 2 years ago.
Yes, and so it's expected that people are expecting that more people are going to be disenrolled from their benefits in the shortest period of time than any other state. Is that true?
We are one of a handful of states that are going to do it in less than the option of 12 to 14 months. That is accurate. We are doing that in response to the fact that we have a state statute that directed us 2 years ago that at the end of the public health emergency, we would begin the process and we would finish the redeterminations at the base level within 6 months. So we are trying to comply with the statute. But in addition, I think one of the things that we are finding is people are moving within the categories that we've seen, and we're going to find some people do have other coverage that we don't need to have them on Medicaid. They should be getting their other coverage elsewhere. It's not a perfect system, but I think we are going to honor. We have to honor the statute to unwind, and we're trying to take very deliberate steps to do that as effectively as we can without harming anyone.
Do you have the staff to do that?
I believe we do. We have maintained approximately 100 eligibility workers throughout the state in the 75 counties. We also have added about 250 contract workers through some of our contracts for surge support, and we have the option to add additional staff. It's one of the things we're monitoring every day with the phone calls, with the returned mail, with the traffic coming in and out of the state offices, and with online renewals, so that we can see, is there a surge and do we need to add additional staff?
And I think you meant 800, not 100 eligibility staff.
Oh, what did I say? I'm sorry.
You said 100.
We have 800 eligibility staff throughout the state. If I said that wrong,
I was like, that's a big difference.
Yeah, that is a big difference. And we have 250
Yeah.
contract workers, and then we have the option to add additional workers for this time period.
Okay, I don't know if everyone understands the churn process, but from my understanding, there's two types of churn. One where people are no longer eligible for Medicaid. And so the other is when people, either you don't have the right address or they don't respond in the appropriate amount of time, and so they end up losing their services, but they still qualify, so they can reapply and so forth, or be transitioned to another program, whether at one point they were on Medicaid, now they qualify for AR home or whatever, but they still qualify for some type of service. But the process of getting or continuing creates gaps, either in terms of weeks or months. You know,
Yes, sir. And one of the initiatives we've taken on in the past year to help with the churn is recognizing that people move or they change addresses or phone numbers and things. We've actually worked with AFMC and others, and we've spent the time updating in the system your names, addresses, phone numbers, contact information, and we are aware that we've updated 125,000, if not more than that. I think the last information I saw in January was we had already updated 125,000. In anticipation, I think one of the things, we are conscious that there is a churn, and one avenue that we chose was to try to keep that information updated during the public health emergency. We have some sister states that have not done that, and I think their churn or potential unwinding process will be a lot messier than ours. And so I do recognize that there is churn. I don't have a foolproof way to stop it or not have it, but I am trying to find ways to make it a lower percentage during the redetermination process. And I welcome other ideas on how to do that. We've done the reach out to update the systems. We sent some postcards. We've met with different entities, associations, and advocacy groups to get the word out that this is coming. We've done some paid advertising. We've done social media, and I don't know that I can ever eliminate the churn, but we are trying to reduce it.
And Mary Franklin's not here today, but she and I were just talking this week. They are adding something new, so AFMC, right now they're handling our update call line, and they're going to help us call people who have not returned their packets. So we've got a list, and if we can see that list and try to reach out to people to try to eliminate that churn, just one more step. I don't think we'll ever eliminate it all, but we are looking at that and trying to take additional actions.
And we've done some, yes, ma'am.
So during the update process for addresses for families, my son was amongst those. His messages were sent and mail were sent to my niece who has a similar name.
Okay.
So the problem is that, yes, it was updated, but I got a notification 3 months in a row that he was going to lose services because of an address change. That was an error in input. So my question is, and on the notification, there was no contact number. So I literally emailed everyone just to get a response, whereas I guess for me a solution would have been a contact number to someone I could speak to. Because I literally called 7 people without an answer, and then I emailed. And so I would love on those notifications if there was an actual contact number that I could, with someone that I could speak to, because again, I just got a notification that say your son is gonna lose services because he moved addresses, to someone who was not me that got the mail. And I'm probably sure, I don't know if one of you got my email too, but
We could have.
Probably Robert.
yes. But I literally had to email everyone for an error that some families may not even know had occurred if that wasn't my niece who received that notification. And so what steps, if any, can be taken for other families who may be in a similar situation is my question.
There should be the number on the notices that people are mailed. And Gavin, is the phone number, like the text and emails that people are getting, the 800 number is on those?
It's in the email, it's not in the text.
Okay.
Okay.
Normally county office numbers on those notices.
Yeah. So I think we have some follow-up for consistency on numbers. So we'll take that one back as an action item
Yeah.
to investigate. But
And we have a team looking at our notices too.
Yes.
We do look at our notice enforcement office.
okay,
My question, it's kind of almost a follow-up of hers, and then kind of to follow up for her question as well. Being that it's such a big campaign, like people are asking, like, what does the notices look like? Was it a postcard? And maybe one of your campaigns, can you kind of maybe show the families what to expect or what to look for? Because with some families, you get quite a bit of mail from quite a few people, and if you have more than one, we don't know which one it looks like. So maybe in one of your ad campaigns to show us what it looks like, or in our emails that you receive, if we're sharing information with other families, because as for me, I have a lot of families that are saying, we don't know anything about, anything that's going on, period. And so to be able to share that will be good. And another thing, being that it's such a big campaign, and like she was talking about, like she had to go through all, there was no numbers or emails, she had to go up the chain to try to find out, is there not like a Super Saturday or something where you can offer some of those, the people that you have on staff for families, number one, who may have questions and we're working during the week, or number two, who may be intimidated by the packet and may not be able to fill it out, that you have somebody there that says, okay, we're here to help with any questions, we're here to help you fill it out, and to make sure that the steps that we're doing is correct, so we won't have to keep going back over one minor mistake that may be like, okay, well, now you're not ineligible because of something minor, then you have to wait 2 to 3 months to get it all through again. So since it's such a big campaign, I just feel like it would be something to add more than what we are always used to, and having to find numbers and stuff, and to make sure that what you're needing from us, we're able to give to you.
and thank you for that feedback on the Super Saturday. I like that idea, but I think Gavin had some specifics on the notices.
Yeah, if I can just share real quick, it's a great suggestion, and we recognize that it is very important to share with folks exactly what they need to be looking for. So we do have that on our toolkit at air.gov/renew, which is kind of where we send everybody in our campaigns, is there's a big picture there of exactly what that letter will look like. And I think you're right, we can increase the platforms that we're sharing that on, but right now we're certainly sharing that with media, we're putting it on social media, we have it planned on our digital bulletin boards, because you're right, that's critical. If we're telling people to watch their mail for something, we want them to know exactly what it will look like. So we do have that on that website, and we'll work to increase that and get that out as much as possible. It's ar.gov/renew. So that's where that URL will be on most of the materials that we send out. And it really is a good landing page. It has all the information about what's going on. It has flyers. It has emails you can send, all sorts of resources, both for beneficiaries to share with folks they know or to educate themselves, but also for partners, for media, anybody who can help us get the word out. It's a great destination to amplify that message. Yeah, so we have the department, if you search Arkansas Department of Human Services on Instagram, on Facebook, or on Twitter, you'll find our accounts. And we share across all of those, as well as LinkedIn.
And I think as an action item, we can send y'all, why don't we send to the council the link
Yeah, we can put the link.
to the Renew, and that way everyone will have access to the toolkit.
And we can
from
send the
there.
direct links to the social media accounts too. So.
And that Super Saturday idea is really good, so.
I completely agree. Like, I'm blown away by that Super Saturday or even extended hours, because you think about it, I live in White County. I can always contact someone on the phone, right? But I know Pulaski County, I've gotten Medicaid stories where people are having to go into office where it's like you can't reach anyone on the phone. So I'm blown away by that idea. And also thinking of extended hours, because it makes me think of when I worked in insurance. Like, if there was a natural disaster, you know, the company is offering overtime and all these things in order to make sure that they're able to file the claims for the people who are impacted. So in this type of situation, it's not a natural disaster, but it is the impact of a public health emergency. So I think that's like an excellent idea. The other thought I had in my brain was that also, I do remember like when we were talking about the renewal notices like last year, and it just popped in my head because I had gotten like paperwork like maybe in the last 2 weeks. And I thought we weren't going to use public health emergency, that wording in the verbiage of the letter. And I noticed when I got it, it did say that. And again, because obviously we've been hearing this, and also like with my job, I know what that is, but it did make me think, oh wait, there is no explanation as to what a public health emergency. I mean, like people also, if you've been extended for 2 years, you may not necessarily be thinking, oh, my health coverage has been extended from this time, if you're not already getting that information from news outlets, or you're just working and just kind of getting a notice. So it's just something that I was bringing up because I thought initially we said that it wasn't going to be on there, but I noticed that it was on there. So I'm concerned about people who, since it doesn't have like an excerpt of like saying, during this time period for the past 2.5 years, like what's really good on the website where someone may not go to DHS's website to see what they're talking about.
Yeah, and so you're right. We originally were not going to have that on there, and Gavin, correct my memory if I'm wrong, but so when the public health emergency began and we started extending people, we had to include language on there that explained the public health emergency. But on the back end, we were not going to include that because it's confusing. People don't always know what it means, whatever. But the attorneys felt that because we had included it originally, we needed to include it on the new notices when they came out. So it was, is that right?
Yeah, that's right. The only thing I'd add, and it's hard to see it from you just looking at the finished product, but we did greatly reduce it. It was much more prominent. What we did was we added a section that just specifically fulfilled what the lawyers said we needed to have on there to make sure that if somebody was comparing old notices, they weren't confused that, well, 6 months ago I got something that referenced the public health emergency and this one has nothing about it. So we did try and make it clearer, but we did find that we had to have at least one reference to it.
And I think like in general, just because we're in this meeting and we're talking about it and we know what it is, it's good. But like just, I'm trying to think if I wasn't me, then maybe if I just saw it referenced once and not even like a sentence to say, like it could just literally maybe be 2 sentences. Again, I'm just thinking of like the average person who may not know about what's going on. And I get why you may have taken the verbiage out on the front end, but maybe just like a one-liner. Because when I read it, it was me thinking like, oh wait, I thought we're not going to put this in there. And then like, say if someone doesn't know, again, say if someone had even gotten those notices before and they're just looking at approved, right? And I'm not reading all the details of this, right? Like, okay, I got approved, So I'm just trying to think of other people who may not be me,
Yeah.
So I do have one question. In January, I received a notice. DHS was wanting some information from our family. So I went to Access Arkansas and I created an account and I uploaded the information to the account. The PDF was attached to my account. Well, I never got an email confirmation saying, hey, you did attach something. So then I get a letter in the mail from DHS telling me that I had not supplied the information. So then we were like, okay, we had to make a trip to our local DHS office to go in to get the information. So that finally got cleared up. Then we had a son that went into the hospital with acute respiratory failure, and one of us had to back off on working so much, so we had a pay cut. So then we went back to DHS, told them about that, and then we thought everything was fine, and then I got a phone call from the doctor, and they were refusing to see me because they said I had no insurance because DHS had put me in a pending status over a paycheck that was less than what we normally made, and the employer had even put on there that we had to reduce our working hours because we now have a child with chronic lung conditions. Thankfully, a lady at DHS was able to, I had to miss going to the doctor. I didn't get to go. But thankfully, within 5 to 7 days, they were able to fix that to where I could then go to the doctor. So I just want you to be aware that there are things that are occurring.
And just kind of like to follow up with your comment, I kind of feel like with the public health emergency going on and all the other things going on, also as we're beginning a new administration, that it's important that we kind of help educate people of what is the public health emergency and what is not considered part of that, the reason you're getting cut off benefits. Because I'm going to play devil's advocate for a minute and say that Arkansas is one of the states that has allowed the welfare system, so to speak, to be used long-term when it was never intended to be. So as all this other stuff is starting to unwind, yes, the public health emergency is ending, but the public health emergency, as far as for the people that's affected, the people that we're advocating for, most of them are not gonna lose coverage, because that their people are looking at that. A lot of this will also be people that will be losing coverage because they do make too much, and it hasn't been checked up on in a couple of years. So I think also maybe if DHS could offer some help, that is like, you don't qualify for this, for DHS services anymore, but here are this option for you to get affordable insurance, or for you to be able to make your ends meet at the end of the month because you don't qualify for these services. And it's gonna be hectic in the middle of the public health emergency, but I feel like if we're offering that and getting that going, it's gonna allow the public health emergency to go a lot smoother, because if I'm saying, okay, I'm looking at you, you just don't qualify because you made too much money and we hadn't checked on it in 2 years. But let's help something else let me help you get something that will help you long-term and still be able to receive benefits, still be able to understand how to make ends meet, but it does not fall under the statute of public health emergency. At front, it's a lot of work for us all. In the end, it's a lot easier for all of you guys.
Well, and one of the things, and just to follow up on that, one of the things we are doing that is different and additional, and we can probably still improve on it, is when you go through redetermination, and if you are determined ineligible due to your income, we are going to be sending that information to the marketplace. And marketplace is a federal marketplace here in the state. So we are reaching out to some of our partners at AID and which is the insurance department. I'm sorry, I use a lot of acronyms. Insurance department, and also, what is ACI? Health improvement. They have a lot of access to information. So we are trying to see how we communicate that information back to the new ineligibles to give them options, but then also follow up to see, did you obtain coverage? What else do you need? So that is a piece that is emerging. I can't say it's perfect yet. It may never be, but we do recognize that we do need to do a little more for the people that are going to be determined ineligible to obtain some additional coverage. So, yeah, go ahead.
Okay, so just in response to that, we have 100 Families Initiative in Arkansas. I don't know how many people are familiar with it or how many aren't, but Hope Hub is already designed to go in there, and those that are not eligible, that because if they're receiving TANF benefits, on the back end, somebody from Restore Hope can see that, and then we're monitoring in our dashboard every 30 days of reaching out to those clients to make sure that bridge is being gapped and we're serving our people. With a dashboard like that already being in place, is that not an initiative that DHS can also push, because it's already established?
I'm thinking. I want to follow up. I want to hear some more details maybe after we get through this, but I want to follow up on those details. She did, and she referenced Restore Hope is a partner in several areas of the agency and other agencies, but that may be a link to connecting with the federal marketplace, but also a link to connecting other people in state government to obtain coverage. I got to think it through, and I like the idea. Okay.
And we can reach back out to DWS too and just make sure they've got stuff out. I mean, we can't give them a list of clients who would lose coverage, but they could share the basic info. And we talked to them, we've been talking about this for over a year. So we talked to them a while back, but we need to reach back out to them.
So one of the things I have been asked, and we're struggling how to answer it correctly, is we've had several insurance people and several people that really want to help asking us for a list of people as they disenroll. Well, due to HIPAA and due to privacy, I can't give out a list. And if I give out a list, if it had been procured, if we had gone through the steps and we had protected it and encrypted it and done everything that was needed to be done, I can't just give it to a select. It needs to be open for public consumption, which I don't know, that's not what we're getting into. And so while we've been asked some very targeted, can you give us a list, we've been restricted due to HIPAA and privacy, but still trying to find how do we bridge that gap and share that information appropriately with the different entities. It's okay.
When the clients are signed up in Hope Hub, like when they're meeting that first person of contact, they sign a HIPAA consent, and it literally has everybody listed. Can we share your information with Workforce? Can we share your information with DCFS? Can we share your information with this person? And you have all of that done at the point of contact, where it's people like me that are the court, working for 100 families. Like, we have all of that at the point of contact of the client, and then somebody on the back end from the state can view all of that. And then also the marketplace insurances that are in these alliances can also view that, and we all have permission already. We already have a HIPAA form filed, we already have a consent form signed, and everybody's covered.
That's why I want to follow up with you. So.
That's a really great idea. And that kind of is what I was going back over too about kind of is somewhat related to we're talking about data matching and things of that nature. Is there a better way? I mean, all this advertisement and stuff and all that's wonderful, and the social media and all the things that we're doing, but is there a better system we can put in place to match data together? So, because if your situation doesn't change, or if, I fill out I send my income to probably like 10 entities. And it just blows my mind that none of those entities are linked together to share that information. Even if I check off a box and say, yes, you can send my tax forms to whoever, or, the free lunch and things, yes, you can share. Even though I check off those boxes and send all that, none of that's being communicated. I still have to send 10,000, fill out all these pieces of papers and send all this income stuff and all these things to these same organizations that will not share any of that information with each other, which is ridiculous, because I think it's also a lot of people talk about Social Security disability. Why do you have to every single year verify that you're still disabled when you've been disabled for 20 years or 10 years? It's not going to change. If your situation is not going to change, or if it only changes a little bit, why is there not any way to do the data matching, or to have a hub where you can sign a HIPAA form, or and share some of that information, so it takes the burden of all that paperwork? Because a lot of families have I have 3 kids plus me and my husband, so that's 5 people that I have to constantly fill out stuff for. And I'm sure there's been a few times that I've gotten notices in the mail from Medicaid, we didn't get this, or we didn't get that, or Social Security didn't get this and get that, and nobody's sharing information. And so it becomes a hassle and a burden, and it creates a lot of these problems. So, I would like to hear more about that and see if there's some way that we can. I know with the online portal, y'all have brought in SNAP and all these different Medicaid programs together. I just wish there was a way to bring in even more and make this so much easier, because I do believe the advertisement and getting the word out to families is great, but it's still not eliminating all that paperwork and all that burden on families that they're having to do, which I think is causing causing people to lose services.
Yolanda, I saw your hand up. Did they answer? Okay. All right, we're at noon, so we're going to break for lunch. Thank you for all of your questions and your attention. Thank you, leadership.
Yeah, thank you very much.
We have 2 new members who have joined the council who we haven't gotten to learn much about. but we're about to. I'm going to catch Angelica before she starts her lunch. She just had her picture taken, and so I'm going to bring the microphone out. We're going to meet Angelica Yanez and Michelle Pedro. They're going to share a little bit about themselves, where they're from, what got them interested in the Medicaid Client Voice Council, kind of their life situation. So let's hear from them before we get into the second half of our agenda. We'll start with Michelle.
Hi, my name is Michelle Pedro. I live in Springdale, Arkansas, and I joined the Medicaid Client Voice Council because I wanted to represent the Marshallese community living here in Arkansas. And Medicaid, I do help them with their enrolling them with their insurance, not just with Medicaid, but other health insurances as well. So I'm here. If you guys have questions about the Marshallese community, ask me.
Thank you, Michelle. Angelica?
Hello, my name is Angelica Yanez, and I also live in Northwest Arkansas like Michelle. I used to work for Obamacare for a few years, so I kind of got to see how the insurance process worked in the marketplace side of things. And after that, I worked at Goodwill with the community. So I've always liked serving people and working with the Hispanic community. And I've been an interpreter at the Rogers Public School District for 15 years also. So yeah, I really like helping others. And so if you guys need an interpreter.
Great. Springdale and Rogers, we appreciate you making the trip to be with us at our meetings and representing that area of the state. So I mentioned we're going to juggle the second half of the agenda. We're still going to get to all three of our agenda items. We're going to start with just a short presentation on the work requirement. It's something you may have heard about, something that you may have some thoughts about because it's been attempted in the past. This is a little bit different. So Janet's going to come back up and just give you a brief overview of it. A lot of the details are still being ironed out, but she's going to answer any of your questions that you have, but first she's going to brief you a little bit about it. Did I catch you in the middle of a bite? Sorry, Janet.
Okay, I'm crunching on my peppermint. I apologize.
Oh, okay.
Come on, it's the Janet and Amy show today. I had to make sure that with session going on, I didn't know if we would be here or not. So Amy and I were prepared to tag team with each other to make sure that we get this covered. So I'm sorry, I thought I was going next. Sorry. Okay, so just some basic background on Opportunities for Success initiative, and then we can open it up for a few minutes of question and answers. So Governor Sanders asked the DHS team to develop a work requirement program for AR Home. I don't like to call it work requirement. I'm calling it Workforce Development Success, which is the Medicaid expansion for able-bodied adults 19 to 64. And so some of our guiding principles that we are developing during this initiative is to provide beneficiaries with the opportunity to help them better their position in life. So the ultimate objective of this is, if you're on AR Home, it's not to punish anyone, it's not to put anyone off of Medicaid, it is to actually move you above Medicaid if you seek that opportunity or have that opportunity to do so. Also, there is the opportunity that if something does not work in AR Home, you'll have the option to go to fee-for-service. So the objective is for no one to lose coverage. I'm sure I will get asked that a great deal many times, but I just wanted to make that very clear. So I don't want anyone to lose coverage. So we're looking at new ways of how people can connect to really make a difference in their lives. Their GAD, trade school, additional opportunities for training to seek different employment. And so there will be different levels. This is in development, so it's all up for discussion. And I'm jumping around because I've had food and caffeine. And so when we finish writing the waiver, there will be an opportunity for public comment, and we welcome that. So I say that will be April 23rd. So then, and since I'm off track, I'm going to let her talk now.
couple things, like she said, like the governor and Secretary Putnam, what they said is make it meaningful. We don't want to check a box that we're doing a work requirement. We want this to be meaningful. Oh, and I'm like talking, sorry.
See, this is what happens when you put us together after lunch.
Yes. So to make it meaningful. And then the other thing, and kind of the biggest thing we want people to know, is we are using the lessons learned from the last work requirement and are not going to repeat those. I was here through that. Robert was here through that. We don't want to do it the way we did it last time. It didn't work. There were issues that really needed to be addressed, and we're going to address those in a new and better way. So, and then like Janet said, so it's a pretty aggressive timeline. There's been a group of people meeting almost every day for the last 3 weeks, talking about the approach, and we're calling it the Opportunities for Success Initiative. And it'll be out for public comment April 23rd, and we'll get it to all of you guys. We want your feedback. We want you to tell us everything you like and don't like and what you think would be better or different. We want all of your feedback. It'll go to CMS for approval June 1st, and then we hope to launch January 1st of 24. Did I miss anything else?
I don't think so. And now that we've both embarrassed ourselves with y'all and with each other, we'll open it up to Q&A. I know.
It's a problem. Okay, I'm sorry. You gotta listen to the question.
What is the ultimate goal of the work?
Well, I think one of the ultimate goals with the Opportunity for Success is to open up additional opportunities. Just being on Medicaid, being on SNAP, being on TANF, they all have SNAP and TANF already have a form of a work requirement. In Medicaid, having an opportunity to have some additional training and additional opportunities to take advantage of, to then complete with all of those other programs to give you the opportunity to do something. It's not mandatory. It's an optional program.
Okay, wouldn't it, just my opinion,
Yes, sir.
wouldn't it be better to provide incentive for people to start their own businesses? You know, become entrepreneurs, you know, to make a real difference in building wealth within Arkansas, instead of just looking for a way to kick people off the benefits?
Well, I'm not kicking anyone off of benefits, but I also think this is an opportunity to create new entrepreneurs. If people can get their GED or additional training or have some form of trade school or opportunity that they're interested in taking advantage of, I think that can make them an entrepreneur. I don't think this will prohibit that.
And one of the things that,
No, go ahead.
I was going to say, one of the things that the governor talked about during her press conference was filling the workforce gaps. And so ADE has some really good data where it's not the low income or the high income jobs where we're seeing the most gaps. It's those middle vocational training, plumbers, electricians. Look, Christy's coming right.
Yeah, she couldn't resist.
Well, I can't leave them unsupervised. So, just kidding. It's a very good question, and I would say that's not off the table. You know, the governor is looking at all things workforce. We have so many employers out there who need people, especially in the skilled trades, the middle area jobs, the vocations. But there are other service industries that are in desperate need of people, and I'm also part of the workforce cabinet that the governor created too, that consists of 6 secretaries. Each of us has some sort of programming that's geared toward workforce development. And so, we're viewing this as an opportunity to how do we better connect people, to opportunities that they would like to pursue so that it can be an entrepreneurial or it can be a career pathway, and it's not simply a mandatory, go check a box and get a job anywhere. We want this to be a meaningful. And by the way, this is not just in Medicaid, it's across the board. It's what we hope for just, being able to better connect people to opportunities that are providing pathways that are meaningful career pathways. But
Are you working with the Department of Workforce Services.
Yes.
How is that integration going to be happening? Do you have any idea? Have you talked with them as part of the planning process?
We have
And how many
had-
other stakeholders are you planning to involve in this process?
We have spoken with DWS, we've spoken with ADE, we've spoken with corrections, I'm forgetting somebody. We are trying to reach out to all of our partners across state government on this initiative to be collaborative on data, operations, staffing from the beginning to the end. So we are seeking that collaboration. I think that is one of our lessons learned, is to seek more collaboration than we did the first time.
Yep. Veterans Affairs, Labor and Licensing, Corrections, Workforce, the Commerce Department, so Workforce Services, Education, and Transformation Shared Services. So all those cabinets, and we'll pull in, you send them our way, we'll pull in anybody. But we are very passionate about the fact that we have a lot of opportunities. We would like to see the trend shift from Arkansas being one of the poorer states to really making strides to move beyond that.
Yeah.
I have a question.
Yes, sir.
My mom is on the AR home. Will, under the governor's announcement that she made, will this be considered work for a caregiver? Will AR choices be considered as work? Because the last administration didn't consider it as work.
Yes, so a caregiver is one of the things on the list that we do consider as meeting the requirement.
One of the questions, I'm from Sharp County, which is, the DHS office up there is small. But one of the things when we turn in paperwork to you guys, they just take it from you and say, we'll take care of it. Would it not behoove all of us to let them just scan and say, oh, you didn't put your signature here? Instead of it coming to the state, you deny it, then it has to come back to them and it's all over again. Is there a way, or should they be doing that? I mean, scanning, I mean, just looking, you know.
I don't,
I wish,
yes,
you know,
no. Yeah,
I mean,
I'm
should
like,
they be
okay, I
doing
need
that?
Robert up here, but no, had
After
a
I
couple of
told you
different
what it
thoughts.
Is that something that they should be doing?
I think that should be one of a core tenet of our customer service, and I think
Yeah,
we
I
need to
would
work
think,
on
yes,
that.
yes.
And so,
Yeah, because that's currently now in our business process. If you do bring anything in, that's how we get your information into the system right quick, so we can get someone on your case. So anything coming to the office, we scan it in, because it go to our
Let me
electronic.
spell my county for you. No.
I know. Yeah, I
Because
got you.
also, last week, you all, or last month when we met, you all said every county, all 75 had kiosks. I just went by just to check. We don't have a kiosk in our county.
Yeah.
Sharp.
You don't
It's
have-
at Missouri almost. Oh, please. Don't mention my name.
You, did they tell you the kiosk didn't work, or?
No, I think she went in. I was sitting, and I think it was
Oh,
behind,
gotcha.
I was sitting, and I think it was behind the curtain.
Yes, ma'am. Mhm.
But I don't think it was for public use.
It's public use, yes, ma'am.
Oh, okay. Y'all going, it's up by Missouri, right up there on
Yes,
the
ma'am.
line. just
Okay,
sharp
I got you. I got you.
Yeah. Yeah, just check on that, but don't mention that.
I can't speak to everything DCO does, but I will tell you one of the goals of this, one of the lessons learned that I've been meeting with Amy every day. I'm so thankful that we are trying to make sure we're doing is that you don't have to bring that piece of paper into the office as much. If we can match your data to all of these partners that we've talked about, as far as you're working, you're getting you're employed, or you meet one of those other requirements that will be listed out in the waiver, you don't have to report anything to us. We take you off the list, say check, we're going to send you something that says you're meeting it, and we move on. So we're trying to limit the amount of reporting that you have to do, so you don't have to hand that sheet of paper, in this program at least, within that. So I did want to throw that out there for this. And then I also wanted to back up to one of our goals here to address your loss of coverage. Nobody is losing coverage. And not only are they not losing coverage, but they're not losing benefits. The benefits that we're moving them toward, if assuming the waiver goes as is, covers all the same things they receive in a QHP. What they don't get is that QHP, which we consider sort of a way to transition and avoid the benefit cliff of Medicaid. And everybody knows what that benefit cliff is, right? You don't want to start making too much money because you just lose all of your benefits. But on the federal exchange, they offer subsidies up to, I think, 400% FPL. So if we can keep you in a QHP, that is the same coverage that you would get in that exchange, the same networks, all of that, then you will more easily transition off of Medicaid and into a regular insurance program, which works differently than fee-for-service Medicaid. So that's one of the reasons we're doing the distinction between people that are engaged in the program and people that are not. And that's all I wanted to add.
No, I'm glad.
Feel free to stay up here.
I was just going to say, even with the transition, though, it kind of shows that even though we say there's no difference in the type of coverage, that there is a tiered coverage and that there are quote-unquote benefits in being in AR home compared to going to traditional Medicaid. I also just want to make this known that research shows that most people who are on Medicaid are working. And so I think it's important that we combat that stigma and also try to prevent all this additional red tape and work that call centers or that the office of all these offices that are going to have to process paperwork in order to remove people from AR home. Where could these resources be spent in addition, instead of putting them towards taking people off and having to put them back on? It's like, that's additional red tape and additional money that could be spent going to other programs.
And I kind of just follow up from what Cassandra said. As we're getting into these work requirements, work programs, understanding of how it works, what's going to take place, what's not going to take place, taking into consideration rural Arkansas counties that are out of the way of everything else, don't have big employers, could there not be some form, and I'm just going to throw it out there because this is what my experience is in, bridges out of poverty, where if we dump $400 million into this work program, but we don't change the mindset of our people, we just wasted $400 million in the state of Arkansas. So instead of the 20-hour work requirement, complete the bridges out of poverty or some form of educational forum to educate people of why we want to move them off the tiers of Medicaid and to AR choices, and not just saying, oh, they think I just sit at home all day and be lazy, so I'm just not going to do nothing. I'm just not going to do it at all. They can't not make, what are they going to make me do? But if you educate them in saying, no, we believe you can do more, is why we are pushing you, we want to see you do more, then people are going to be like, oh, I think I'm going to go learn about that so that I can do something, as Mr. Watson said, to create generational wealth. If I've lived in poverty for 15 years of my life because that's all my family knew, my kid is not going to have to, because we're integrating new educational programs within human services that will allow us to teach them of why we need to get out of the state that we're in, of being comfortable.
So do you want me to take this one, Janet? Okay,
First
first off,
you start and I'll finish.
There's a bunch of you I want to hire to come work at DHS if you're interested in a state job. Just first. Second, you make great points. Both of you do. There is no 20-hour work requirement this time. We learned that last time. We don't want to do that anymore, at least the way we've designed it. Now, let me clarify that the way we've designed it has not been approved by the governor yet, so this could change. But we hear what you're saying loud and clear. And what we're trying to design is just that, is a bridge to an opportunity, a way for someone to develop their own work plan for us that they can show us progress on to meet the requirement. That's what we're putting forward. That's what we're offering up to the governor. And again, she has the right to deny that, but that is the plan that we're putting forward, is exactly what you're talking about. So we heard that loud and clear the last time. And we're really looking at ways to help people move forward and create sustainable opportunities for success. Anything you want to add, Janet?
No, they have been the nuts and bolts of working on the waiver, which is why I needed them to answer the Q&A.
And why I want to hire some of you to come work at DHS. If you're interested, just let me know.
I guess one more question. Still, it has to get approved by CMS, and CMS could still say that
is true.
Based off of whatever the findings, that it's not approved.
That is correct. It will
And then
have-
it can't be implemented in any way if CMS says no to it, correct?
That is correct.
Okay.
CMS has to approve it.
All right, one more question, and we're going to move into the open discussion.
My question is about the Medicaid, traditional Medicaid, and like when your plan changes. I had a daughter 2.5 years ago, and I had no idea that my benefits, my Medicaid benefits, were going to change once I had her. I was on a Blue Cross Blue Shield plan, and I had been getting physical therapy for years, and nobody told me, nobody sent me a letter from any agency, not DHS, not anywhere, or Blue Cross Blue Shield telling me that my plan was gonna be switched over to Medicaid automatically once I had my daughter. So once I had my daughter, I was just automatically enrolled in Medicaid, and I think there could be like more communication from somebody, from a case manager, letting us know, because that did affect my services a lot, my health care.
So I'm sorry that happened. First off, let me say that. We are aware of some of those issues. We're actually working on our notices, and Janet and I have been talking about some of this internally. We're having healthy debate about it. But we're working on how to solve some of those problems as well. I'm also having internal discussions. So one of the issues is there is a physical therapy benefit in fee-for-service Medicaid, but it is at hospitals or rehab clinics, like rehab hospitals only. You can't go to an outpatient clinic to receive that adult physical therapy benefit in fee-for-service Medicaid. That is one of the issues with transitioning from a QHP to fee-for-service Medicaid. So that is another issue that we're looking at, just so you're aware. I don't have any recommendations to stand here to tell you today, because that work group is ongoing, but we are aware of some of these issues and looking at them. We are also working on our notices to tell you what the differences in those coverage things are. But just so you're aware, when we do that, that's actually a CMS requirement. If you meet a different eligibility category that isn't considered our home, we have to move you into it. So they should have given you notice, but that's why that happens, and that's what Jane and I are trying to think through solutions for.
It seems like there's not any communication between the health plans and DHS, and there isn't any communications between Medicaid and the PASS either. My other question was about the work requirement. I became a single mom after I had my daughter, and the requirement changed to where I had to file for child support through the Office of Child Support Enforcement, or else I would get my benefits taken away. Then when I did file, I got another letter recently saying that if I did start working, that income was going to be docked from, so I was going to get the child support money that I get, that it was going to get taken away from my my paycheck. So
I'm looking at Robert on this one, because I don't know much about.
Yeah.
I don't know much about how that works.
No, when you had to, when we had to do a referral to child support, what that did, you had a non-custodial parent outside the household. So we had to make sure child support, what they do, they establish fraternity. So long as you cooperate with them, that don't affect your case at all, even with your income. It shouldn't affect your income or anything.
Well, I got a letter that nobody could explain it to me.
Yes, ma'am.
Saying that if I had any kind of income,
Uh-huh.
that my benefits would be taken away from that income.
Now we use that income in making your eligibility determination. You stay within, we know your income, your eligibility determination level been established. So only if your income change, we look at a redetermination, see what type of coverage that puts you in then. But the child support wouldn't have anything to do with your income and cutting you off.
So,
Jason a note.
Yeah.
what
We need some.
I think my
Yeah,
concern
yeah.
is what would be impacted is the amount of support that I get from,
Child support.
like I'm a single mom, so I get help with my daughter's cost of living, but when I'm at home taking care of her, all of those expenses are on me. And the way I understood the letter is if I start working, the child support money, I'm gonna have to pay that to myself, is how I understood it, because nobody could give me a better explanation. I went into the DHS office, and they said, you just need to call the Office of Child Support Enforcement. Well, they didn't know anything about it either.
Yeah. Okay, because sound like what you're saying is on the child support side, because they got a case on you and stipulating you getting child support through the clearinghouse. So they saying if you make any type of income, would that affect the child support you're getting?
Yeah.
So I don't know their requirements on their end regarding that.
Again, there's no, I feel like there's like, the Office of Child Support
Right.
Enforcement kind of gives me the runaround with DHS, and nobody really knows how that works because on the court, like on the order from the court that the judge awarded, it said that I was supposed to pay a third of the child, or that I have income, which I really don't have.
Yes, ma'am.
So the way it was set up, it is, I feel like it's gonna impact single moms like me, where we're gonna be discouraged to want to get a job because our paycheck is gonna be docked. So what's gonna be the motivation for us to participate in the
Okay.
program?
See, okay, I got you. I don't know child support changing, but normally when you approve and you getting child support through the clearinghouse, normally that don't affect your child support. That's come from the absent father. They don't have anything to do with your income.
I'll bring
so
the
I'd be
letter
surprised.
with me next time.
Yeah,
Okay.
that would,
Send it to Jason.
yeah, I think the email would be great.
You want to talk to her then,
Well, I mean,
Yeah,
after,
yeah, it's not a DHS or a child support thing, it's communication, the way they labeled it, so, basically, if you've received state services for over 2 years, and the non-custodial parent, you're drawing the state services, then what that letter states is once that person starts paying back child support, the state will deduct a certain amount of that, which will be 1/3, to pay back for the benefits that you used that the non-custodial parent wasn't buying. So you'll get 1/3 of that. That is deducted by the state for services that you have received, which are Medicaid or food stamps. 2/3 is gonna go to you. It's not gonna affect you actually going to work. It doesn't take your check. It just takes a portion of the child support to put money back in the state because that non-custodial parent hasn't been paying anything. And if they just keep allowing us to pull from the state, then nobody's gonna have to fund it there.
I think let's follow up with details.
They don't dock your check. You're still gonna get your check. The only thing they're docking is the non-custodial child support if it is paid through the clearinghouse. If that parent
So
isn't
if the
paying,
state fronts
then
it,
you're not affected
so
at
if the
all.
state fronts it,
If
then they
that
take a
pays
portion
and
of
that
it.
clears, the state is gonna take
Built up, they built up arrears, they had to pay that back.
Don't answer it, I think.
I'll tell you, you share the letter with me and
Yeah,
I'll
I think-
research it and get some
Yeah,
answers.
I understand what Brittany is discussing, but I don't know the rules and the regs with child support to be able to give you a very clear answer. So I think if you could follow up before the next meeting, that would be great.
All right, I mentioned at the beginning of our meeting that some of our leadership needs to go back to DHS headquarters because Governor Huckabee Sanders is going to be having a press conference there, and they have to get ready for that. So we want to move the open discussion part of our meeting to right now while we have our leadership here, and then we're going to close the meeting with the discussion on SNAP benefits.
Yeah.
So if you have a question about any topic that you believe our DHS leadership can address, now's your chance to ask.
Okay, when they announced the new leadership of DHS, one of the goals they said that the governor wanted was to help lift people out of poverty. I think we need to start being more creative about how we think about what causes poverty and how to lift people out of poverty. Because if we're still trying to use the same old techniques that we've been using for the last 100 years, go out, chop cotton, go out, do menial work, income, so forth, we're never going to get there. Doing the same thing over and expecting a different result is crazy.
You have a suggestion or a question?
Yes, I mean, people work every day. So a lot of times they don't get paid. Being a mother is a job. How many people say being a mother is not a job? You may not get paid a check for it. You know, being a caregiver is a job. You may not get paid for it, but you're working. And if you don't do it, people are gonna suffer. You know, you have to be more creative in terms of what you think is work. You know, starting a company is a job. You may not get paid for 6 months, you know, because of the break even. And people in accounting know that. But it's still a job. You know, if you're just looking at a job, is you go out and chop some cotton, and then you get paid a menial salary, and then we count how many hours you work and how much menial money you made, then we're going to continue to be in the same hole.
Do you have a question?
So how you need to involve more stakeholders outside of government, not just the same government agencies that you've been working with for years and years. You know, the economy has changed. Broadband has changed. You know, rural areas are starting to get broadband. You know, the way people create income, how they bring in income through the information superhighway, if you want to call it that, or the internet, is different. There are people out there making money off of TikTok and Facebook. You know, do you count them as having a job? Because they don't clock in and get a paycheck, but they generate wealth. How do you categorize what is work? Is it the same old past that you had in the past? Or are you thinking creatively about what's happening now?
Is there a definition for work? If we're talking about a work requirement, is there a specific definition?
Well, we're not making it a work requirement.
Right.
It's an opportunity for
Right.
success. It's not tied to it's not tied to work. It is tied to outlining your own plan for success, and working with a success coach is what we are designing. So I think we are beginning to think out of the box. I think we have some more creativity to do with Medicaid overall. I think we've begun that. I think for maintaining eligibility, I am tied to the federal rules and regs of income, and I don't have the ability to change that piece. But I think that's part of the reason that we also look at waiver programs and try to work and create different opportunities. I will take your suggestion on engaging more stakeholders than just other government agencies. I appreciate that. We will do that with this opportunity and with future opportunities. Yes, sir.
Yes, my mom is my caregiver on AR Choices, and she just pointed out to me, and I agree with her. She said she thought it was obvious that the people at DHS, with the new people coming in the administration and the old ones that remain, y'all are trying to make a difference.
Thank you.
Any other questions?
I see several hands in the back.
I've had I work for the Center for Exceptional Families, and we follow different Facebook groups and pages, and we get a lot of phone calls to help families. And this was something brought up a while back, so I was hoping that I wanted to see if there's been a change to this. There were a lot of families communicating to us that when they were trying to become caregivers, because that was a big deal last year, that change was made where parents could be caregivers to children or adult children with disabilities on the waiver. And so what happened, though, was a lot of families were saying, I've called every care company in my area, and they said they're not doing this. They have no idea what we're talking about. They're not taking parents on as caregivers, and a lot of confusion, and that people were not able to access this was a really Well, it was kind of born out of necessity because there's a huge caregiver shortage, and so it kind of blew my mind that care companies would refuse to take parents on as caregivers for their children when a lot of these companies have such a shortage and can't provide a caregiver. But I wanted to see if y'all had gotten any complaints about that, and if these care companies have been further educated about it, and if that has changed over, because it kind of, I was confused at how they could refuse a parent as a caregiver, how they could refuse anybody as a caregiver as long as they met the requirements to be a caregiver.
I can answer that. This is on. But Amy shook it so much, I thought maybe she had knocked the batteries out of it. Melissa Weatherton. Hi, guys, DDS. So it went into effect in August, and I'm with you. At the beginning, there was a lot of finger pointing between the providers and the passes, right? And let me defend the passes because they're not always right, but on this one they were, because we had met with them a lot of times. And if you think about it, they're an insurance company essentially. They don't know who's the employee, right? So the provider is sending in a service request, and they either approve it or deny it. And so in their minds, this was not a substantial change, right? We don't ask you if Susanna is working at your house. We just say whether a service is appropriate or not. So we finally got that pushed back out to the Medicaid providers because I think they were just scared, right? And I think they still are a little bit scared of when does a parent's duty end and when does a worker's duty begin? And do we pay people when they take their loved ones on vacation, if they're mom, right? Do we pay them 24 hours if you have a child that's 8 and mom was taking care of them at night before? And now is mom going to ask for more hours? I think there's just still a whole bunch of fear there. And unfortunately, and we continue in the past are working with these providers, and I am seeing movement, and I am seeing providers hire parents and guardians. Not as much as we had hoped, but I am seeing it. Are you seeing it, some?
No, I'm going to say
You are seeing it? Good.
What the other thing is, when I've applied for like personal care hours, and even I'm sure with respite care, I've gotten notices that have said, I have to bring it, but was very, I think I've brought this up before, was very rude, that was like, this is something as a parent you should be doing. And I was like,
So personal care,
nice.
So you can't be a parent and provide personal care. So that's not under the umbrella.
Well, no. It said that I didn't qualify for the hours because what I was asking for
We
is
have
something
an issue there
that should
we're
be
looking
required.
at.
And the issue I have with that, my son is a level 3.
I'm with you.
He could be in a residential facility.
Yeah, email me about this because
And-
we're looking at a couple of cases. Jay Hill's here too. So we're in conjunction with his division, working with KeyPro, who approves those PAs. Because they do, I'm with you, they do seem to have taken a different stance starting in January when the policy didn't change. And we are very confused on why the stance is different.
Yes.
Because I got an email the other day, and the mom had 3 DD kids, and they said, "Well, mom's at home; she can do it." Well, one was like 16 and weighed 190 pounds. I mean, mom can't take care of 3 teenage boys with autism that need personal care, right? I mean, that's too much.
That's what we're seeing is they're saying, well, you should be doing this as a parent and you don't qualify for these hours. But when you have a child, I have one that's a level 2, one's a level 3, and they could be in a facility and costing the state a lot more money. And they don't want to send me personal hours, which is costing a fraction. It's like the cost effectiveness is not there. If I had to place my children in residential, thousands of dollars, and they'd have 24-hour care and every single thing that they could need. And all I'm asking for is 5 hours a week.
Somebody come help you.
For somebody to come help me, and they're like, no, you should be able to do that. And I think I don't, like I said, I think something's changing.
I agree.
And it's causing families that I've noticed to have to put their children into a residential placement, because if we can't get the hours, you won't pay me as a caregiver. What else can you do?
while we're looking into what's going on, what's been happening is people have been emailing me. We've been sending them over to Keypro. I've been asking them to reconsider. We've been instating hours, reinstating personal care hours for moms. We try to figure out why there's been a shift in this concept with them. Because there's a little phrase in the personal care manual that says basically it's the last resort, right? Like if there's nothing else, including non-paid caregiver support. And I think we're just taking that concept a little too far. So we can work on with our vendors to straighten that out. But if you are having a problem right now, please reach out and email me, or have everybody else do too, and we'll have it reconsidered.
Melissa, do you think maybe it's in rural areas? Because we've been doing this for a long time. Family members have taken care, of kids in rural areas and got paid. So I don't know. Maybe. Oh! Am I telling too
You
much?
thought they were getting paid.
I do know.
We are live, yeah.
It is, because, well, first of all, you cannot find,
I wouldn't even know what county you were in, except for that kiosk conversation.
My county's going to dismiss me from this group. But literally, because when you can't find people to come into your home that you or can pass a drug test or something, you can't find anybody. We're the last resort, like somebody said a while ago. Parents were, but we have extended family who watches our kids. So maybe that's not quite family. I don't know. But there we go, extended family. Yeah.
I'm with you, and it's and family should not be last resort, right? And so I think it's just more education to the providers on quit being scared that you're going to be sued. Quit being scared you're violating Department of Labor overtime regs, right? There's just a whole bunch of things that they are just really worked up on because it's different because mom or dad are always in the house, right? So, and I think that's where the fear is stemming from is legal issues. What if you're supposed to have a worker come in, another worker, a non-family worker, they don't show, so mom picks it up. But mom's already worked over 45 hours that week, right? It's things like that I think they're just really getting worked up about. But I think the more providers that hire and everything goes fine and we treat everybody like the regular employee, because that's what it is, you're an employee of a provider, I think it'll start growing.
And we'll do our part to smooth out the contractual issues.
Yes.
Hello.
Hello.
I have quite a few questions, but I'll start with the
She has them
smaller
written
ones
down.
first.
Here we go.
My first question is for, as far as like residential care. So my son was in residential care, and when you, at this particular place, when you fill out the application in, there's a portion in there that says, hey, while your child is in our care, we also have to receive their Social Security for things that they may need and stuff like that, and you check the little box off and go, okay, and all is well. Well, my child was discharged in December. And so I'm like, okay, so how do you get your Social Security back? Oh, well, you have to get a discharge form, and you're going to have to go and turn in some forms with Social Security, and you may have to go up there. I don't even know if they'll take it. And so here it is, March, and they still get the Social Security because I have not been able to reach,
Yolanda, I wish you had called me before now. So
Yeah.
that place has been getting it since December. They're the representative payee now, and it's not you.
So they still pay, yes, because I'm at work. So if you're on hold with Social Security for so long, you have to hang the phone up. They close at 4. So after 4,
I know where he was.
They don't pick up at 3:58. But so how is it? There should be just like somewhere.
Oh, it's super illegal.
So there should be just like something. If it's just that simple for us to be able to give them a way, our check, just a checkbox, should be something
we'll
on
look at
that facility's end that says, okay.
It ends the date of discharge.
It
right?
does, and
Whatever
they should be
that date
giving
of
you the
discharge
discharge
is.
form, and they should be saying, here's a copy of what we sent to Social Security. Therefore, if you don't get your check in 30 days or the appropriate amount of time, call us.
Yeah, or I just wish it was just that simple though, that's a part of their discharged.
Well, we actually had a call about that. Not this. This is bad and it's illegal. And we're gonna need to. But we had a call about when people should be taking SSI. Because really, for short-term stays, I mean, we're really surprised at the amount of providers that are getting families to agree to transfer the SSI for short-term behavioral health stays.
Well, because that's what they
kind of
and
put you
wanna
up
make
there.
And of course, that's me. I'm that mom that's like, what do you need? I got it anyway, you know. But
Right.
it's just the fact that it shouldn't be that hard, you know. They'll say, well, we'll send you your discharge papers so you can send it in. Well, I have to get in touch with Social Security first, you know,
Right.
just to even let them know, hey, this is what happened. I feel that if it's just that simple for us to just check a box to allow them to receive that for our child, it should be just that simple that before discharge, that they check that box and say, okay, they have been discharged, can you please release the money back to them? It shouldn't be a hoop for us
I agree.
to fight through.
I agree.
So that's one.
Okay.
The second one is, and this is all dealing with discharge of my child. So he was discharged in December. I am just trying to find out a way, because as a parent, I don't like to try to go through the chains or connections that we have when we have issues with certain providers, put it that way. But since my son has been discharged, I have been going back and forth with his just basic company that he sees for therapy services and QBHPs, and it has been horrible. And I've had bad experiences with them before, and we had left them and went to another company, but the therapist that we had there, we loved her so much, we went back, because I was like, only you are the only reason that we'll go back. But the company is just so chaotic and so, the communication is horrible. I have been fighting to see the doctor since he's been discharged, and they have been calling, rescheduling. Oh, the doctors won't be able to see you because of this. Oh, they're at the new office. And, you know, my question to them is, why are y'all opening new offices if you can't figure out this office over here? And it has gotten so bad that I just feel like I need to find somebody to call. It's like, can y'all go audit them or something? Because it shouldn't be that horrible that, number one, I have a child that still has yet to see the doctor, in which they've been rescheduling me since January. Number two, I have a neighbor across the street that has used this same program, and she was like, oh yeah, for some reason they either fired or our therapist quit. We don't know who our person is. And I'm like, what? And I was like, well, what about your QBHP? Who is that? I don't even know. And it's just like, it's so much ongoing stuff, to the point I tell my son's therapist, we're packing, so whenever you're ready, we're ready to go with you, because I know you're not happy. And it's not the therapist, it's not the QBHP, it's the corporate side of this company. And if you guys, our last meeting, you told us, you're giving them funds to be able to help us do what we do. I feel that there should be some type of accountability for those companies that are not doing what they should be doing for families.
Text me the name.
I will.
Okay.
I didn't want to say it out.
And you can send it to me.
We're gonna let them ride for a little bit. And then I guess with my third one, it's just I met out-of-state families that attend schools with my son. Just funny story of how we met, but they're from out of states. They have two kids, I think they're twins, but they're mute and have autism, and they have a daughter that's autistic as well, that's at the same school with my son. But they said that moving here, they're military, they had military background, and moving here, there is no way to find like resources. Where do they look to go for resources? And it has been like the worst experience for them trying to find resources for their kids. And once again, as they tell me, we don't know where to begin, where to start. And so those are the questions that I
Well, if you
have.
send them to me, then I'll route them through the intake unit.
Okay.
Okay. But we're getting so much closer on, and thank you for anybody who participated in a survey. I know you did, on the Medicaid education campaign. It's still moving. You know, we've got like 6 work streams going at once, so everything's slow moving. But, I mean, we keep hearing that no one knows how to access anything. And so
We've heard that several times during session also, from looking at where resources, a listing of resources, is it centrally located? How is it updated? Where do we go? What do we do? And we got several questions from an education standpoint and the Medicaid services.
You know, it's weird because we can tell you where what Medicaid services are available. We're not doing a good job on that, but we can fix that. But what we're also hearing is, like, the school guidance counselors don't really know how to help kids with disabilities, like what colleges or higher education programs are there for kids with disabilities or delays, and that there is a huge disconnect. So they came to Janet and I saying, can you help? We try to stay in our lane in terms of, because we don't know, right? So we've been working to say, how do we connect the Medicaid services and the education services? And we do know that there are several platforms, like Blue Cross Blue Shield runs one already that they pay for. So looking at, can we put all of this on one platform so people have a resource website to go to? They already keep up to date, right? Because that was my biggest thing, is how are we going to keep it up to date?
Right.
And we looked at Aunt Bertha just changed their name.
Thank God.
And I can't remember. Move for help. I'll find out the name. Anyway, Aunt Bertha does something similar, huh?
I don't know. But we're looking. I know.
See, I know.
Aunt Bertha. Well, she
that
lives
would
in
be-
Sharp County.
Oh, my God.
That's what we don't know who she is.
She's behind the kiosk.
I think that's why Aunt Bertha changed her name. So we'll take it back as an action item for different ways to look for resources.
It's right now it's real medical heavy, but we're trying to make it everything, right? If we can get it all on one platform.
Or at least some links to the other areas.
So, in saying that, I was going to ask for the mic back, because I remember you were saying, like, we have all these resources, like for which you have passed, that we offer. So I told my caseworker and his supervisor that I talk with both of them now, and it was like, well, what is it? Where do we? They don't know what it is or where it is. So yes, so if someone can, and that could be, you know, as far as on the council, that may be an idea to have maybe someone from a past, as far as like a coordinator to know some of these things so that they can pass, because they were like,
I love that.
nope,
Why
I
aren't we
didn't know.
inviting the
I
passes
yes,
to these
so,
meetings?
Yeah, at least a care coordinator, so they'll know, oh, we do, well, let me see who I can.
All right, Cassandra's got a question, and then we're going to need to let some of our DHS leadership go, and we'll move into the SNAP discussion.
Okay, so this is kind of like something that was brought back to me by one of our health partners, RVAC. And so you don't necessarily have to answer on the spot, but it could just be something to like pinpoint me who to talk to. So they have a residential treatment facility that welcomes mothers and children's, and they're seeing issues with trying to locate PCPs with children vacancies for about the last year, meaning that a lot of the most vulnerable children, some impacted by substance use while in utero, are not having access to medical care. This has become very difficult, and then so basically my question was, is there any workaround because of the PCP shortage for children receiving AR kits? So I don't know. It doesn't have to be answered on the spot, but just something that's been thrown out. That's Russellville area. But you're going to tell me something, Janet. I can see it.
Yeah, but I want to hear the last part of the question, because you kind of dipped.
Oh, like is there a workaround, like just as far as PCP vacancies? Because I think that they may have made some type of like, they have someone who's they're working with, but in general they're saying, hey, there's Medicaid maxed out limits in Russellville. Kids are not being seen.
Yeah, well, I'm going to start, and I'm going to let them finish. We recognize that the PCPs are pushed and tight to have, but I didn't make any sense with that statement. But that is part of the reason we're adding APRNs to also allow them to be PCPs.
Okay.
And so that's not going to solve all of the issues, but it was I think this was done in last session or two sessions ago. Last session. To allow that to happen, to address some of, you can't find a PCP or the PCP is full. So that is one thing that we're looking at, but we're looking at other things to do to get more utilization and more involvement. Because lots of people will go through fee-for-service and never be assigned a PCP, even though they need to be. And then I will follow up with you on this, on Russellville with the pregnant women and seeking substance abuse, because I want to connect you with someone specific. Yes, Paula Stone.
Also maternal life.
Okay.
Yes, and Maternal Life 360. I got some ideas.
Oh, and perfect, because
I got some ideas.
You just segued me to what's
Can
some of
we
the
come
update-
back to the
No?
PCP thing?
So that everybody in the room doesn't understand what
So
that
PCP is a primary care provider. It used to be primary care physician. We changed it to provider because we do now allow APRNs to be a PCP. An APRN is a nurse practitioner. So they can be a PCP. If you are for some reason having trouble, we have the AFMC call line, and you can go on there and see who has available slots to take Medicaid clients. Sometimes we have a hard time getting providers to update their number of slots. So they may show they have more open slots than they really have. Call that number, call me. I have somebody that runs that program, and his name is David Ballard. He's Larry Ballard in the system, but he goes by David. We need to fix that. But anyway.
You're looking at me. That's an IT function. I'm passing
Remind
that
me
one.
to fix that one. They can help you locate a PCP if you're having trouble finding one in your area, or help you with some alternatives. So reach out to us if you know some people that are having problems.
Okay, and then I'll reach out to you, see if I could connect you to them.
Yeah,
since there's
that'd be
some-
great.
Okay.
And then what was the Maternal
Yeah,
360?
what's some of the status with at least some of those AR home initiatives? Like, I know that they got approved, but like, what's the status of implementation?
So we are in the process of trying to implement. I'm going to let Elizabeth speak to the specifics, because I think overall they've been approved. I think there's some separate pieces that are pending additional approval.
Yes, that's right. So the Life 360 homes for the R home population, that extended population, has all been approved by CMS. We actually have received 4 letters of intent right now for maternal Life 360 homes, and we have approved 3 of them. So we're hoping to be able to start working with them on a full application, getting them some startup funds so they can start taking clients soon. We are working closely with one hospital that's interested in doing rural Life 360 home, which is for individuals in rural areas with serious mental illness or substance use disorder, and the maternal is for women with high-risk pregnancies. So that's where we are. What's still pending with CMS is we are opening that maternal Life 360 home up for women in Medicaid, all Medicaid eligibility categories with high-risk pregnancy. CMS has not approved that piece of it yet.
I just have one quick question. With the ending of the pandemic, are we still going to be able to do virtual appointments?
Yes, Reba. So we added telehealth to the Medicaid manual, the big Medicaid manual. So it'll apply to OT, PT, speech,
Doctor visits.
We're going in right now and getting an extension so we can keep doing the independent assessments via telehealth, because that's a lot more convenient for people, and we'll make that permanent. Behavioral health services. What am I missing?
Well, our
Counseling.
telemedicine is I think is a positive that came out of the pandemic. It opened that doorway to have more and more telemedicine visits and opportunities. Telemedicine is here to stay. The difference will be we had no HIPAA requirements that during the pandemic. So your providers may change how you connect or what pathway you have to do that, because they will have to be HIPAA compliant at the end of the public health emergency.
And I would say if it requires a hands-on component, like personal care or attendant care, obviously that can't be done by a telehealth. So
Yeah.
That's kind of the guidepost for me on can it be done by telehealth.
And it has to be, you have to have video. So
Yeah.
in the pandemic, we had a lot of telephone approvals, but it was just for pandemic. So all that will end.
And then there were some pieces With DME, we made some exceptions to where some things could be done over the telephone or virtual. Those will probably come under more scrutiny with CMS because of measurements and people as they grow, children, if they have specialized services or equipment. And so that will probably go more back to in-person and that measurement. We probably will always have an emergency opportunity to do that, maybe through telemedicine. But CMS with DME equipment and because of the specialized nature of a wheelchair, things that have to be measured will go back to face-to-face.
All right, thank you.
Thank y'all.
Everybody.
Thank you very
for your
much.
questions and your suggestions. One of the ideas for a topic that came from the council was to learn more about the Supplemental Nutrition Assistance Program. You met Robert earlier. He is here to present on that and take your questions on SNAP for the remainder of our time. So just think in your mind as you hear the information on what kind of questions or suggestions you would have that could improve the SNAP program and how it relates to Arkansans. Robert?
Thank you.
This one actually works fine.
It does, okay. Great, great, okay. Sure. Oh. All right. Text you later. Yes, ma'am. Okay. Okay, good evening again. Okay, you see the slides on the monitor. I want to go over a couple slides at a high level, exactly what this SNAP program is all about. As Jason just alluded to, is a Supplement Nutrition Assistance Program, an acronym we call SNAP. Now, it helps low-income households and families across the state of Arkansas by providing an opportunity to purchase food that increase an adequate diet, to help provide an adequate diet. SNAP benefits are distributed according to needs. So the benefits will help subsidize the people's nutrition for the month. Household needs for benefits are determined through various factors, including but not limited to individual household income, individual household size, and various monthly expenses that we use in determining eligibility for SNAP. So it depends upon the household size, depends on the household makeup, and what expenses they incur that will help alleviate and reduce their household income, which increase that SNAP benefits that they're entitled to for the month. SNAP benefits improve food insecurity. It offers benefits that enable families to purchase healthier diets and increase resources that can be used for healthy promoting activities in need in medical care. So since it's a subsidized program, that alleviate other income that can be used for other purposes. You'll see throughout this slide some other initiatives that's been used to help with the insecurity of food for the family. Do I advance by?
Actually, it's right up there, pointed at that column.
You did. I think it advanced. Okay, good deal. Okay, the SNAP program provides nutrition education through implementing agencies throughout the state. Now, we partner with various organizations. We partner with the University of Arkansas at Pine Bluff, the Arkansas Coalition for Obesity Prevention, and the University of Arkansas Corporate Extension. A lot of these entities are in the various counties. They directly engage with the clients in those various counties as well. With those partners, as we partner with them, these agents, they target kids, they target adults and seniors to encourage more healthier eating, more healthier opportunities. The state primary goal is to increase food intake, to increase the vegetable intake, increase physical activity, increase knowledge about my plate, increase food resource management skill, increase food preparation skill, increase policy, system, environmental efforts toward healthy eating and physical activity. And all that involves with those entities and our partners. They go into the county office. A lot of them have displays, have public education, and a lot of them do demonstrations and stuff within the county. Now, prior to the pandemic, they were heavily engaged in that. I mean, some of them went there and even had meals and stuff, prepared meals and things. Since the pandemic, I think a lot of them go there now. They put their display up. They have pamphlets and educational forms for the family to help them with these various components and give them insight, give them guidance on how and what to purchase with their SNAP benefits to help toward this a more healthier diet for them and their family. Now, farmer markets across the state are increasing and can be contributed to outreach and education from these partners, support from federal, state, and local government. Because, you know, we normally try to reach out to the providers, try to encourage them to be a partner with that, to be heavily engaged with that, be part of the farmer market industry as well. So with these individuals, they help support these areas that we're experiencing insecurity. So when they do that, they incorporate certain benefits and certain programs like the Double Up Food Bank, food bucks. The Double Up Food Bank is like an incentive program. And this incentive program helped the family increase their purchasing power with their SNAP benefits. That was heavily engaged in prior to the pandemic. A lot of them go out and they have these great vegetable things that they grew. From farmers and stuff across. Some of them even went to the county office. They had trailers and things. They went there, and a lot of them have point-of-sale devices. People use their EBT card, and with the double up bucks, whatever they buy, they can double up. Like $1, you can double up for $1 would double to $2, and so on. There was a big positive influence, and a lot of our clients, they really like that. So hopefully with the pandemic somewhat evolving, that a lot of our partners in farmer market will get back to that. Prior to the pandemic, we maintained a list of those active individuals throughout the state. We definitely can. Definitely can go back and see exactly where that list is now, how engaged they are now, because our policy unit normally are the ones that somewhat have oversight over this. They reach out and create these providers, to try to incentivize them to come in and provide this type of services. So I know definitely going to be heavily engaged in that again as we try to shore up that list and get those type of incentives to start back up so they can have a presence out in the counties so they can get those benefits. Another entity is Cooking Matters. It's an evidence-based curriculum that provides education for children and family. And normally our providers are the Coalition of Obesity and the Arkansas Hunger Relief Alliance. They heavily engage in this activity and provide this for our clients that receive SNAP benefits. And you know, at times people come through there, you know, a lot of our clients come through there, don't apply for SNAP, they apply just for Medicaid. But still, I think they still look at those. They look at those pamphlets, see exactly what's going on, get some ideas and stuff as well for their families, since they're not getting SNAP benefits. But they all benefit from what's going on within the community and within the county office once the providers and partners are present. SNAP recipients can now use their SNAP benefits to shop online and for fresh products and grocery. You know, since the pandemic, that allowed a lot of individuals to shop online, and a lot of individuals use the EBT card for their purposes. A lot of them still are not able to get out. Some that I know recently with a lot of people losing their EBT card, but they knew they had their number. A lot of them still able to contact the store and order food and punch in a PIN so they can get their food. A lot of eligible food. Only eligible food may be purchased through the SNAP benefits. So if we do this online, as you know, the delivery fees and other associated charges are not paid for with SNAP benefits. They will have to come out of their pocket to pay for those little fees. When they go online, they also have to make sure they have access to their PIN. They have to validate and confirm who they are in the purchase by using a PIN, as they do to any established facility they go to when they want to use their card. And you see the participant retailers in Arkansas that allow individuals to do online. It's very broad. At first it started out with just a small, like Walmart was a major one that helped out in that. And I think Brookshire was one. But it has expanded to a lot of other providers that enable individuals to call, buy their benefits or their benefits online, and come and get those. Now, I'm giving you a little data about the current makeup of the SNAP program. Right now, we have a total of about 251,546 participants, those individuals that makes up the household. But we only have 130,000 plus household members. The average household size is around 2 for our SNAP population. And average household income, household monthly amount that they're receiving, SNAP benefit they're receiving is a little over $322. Now, the average total monthly benefits issued since June of 22 is $44 million a month in SNAP benefits. So that goes a long way in economic impact in the community based upon them using those benefits and go and purchase the food and stuff they need for their family. So that's a somewhat a high-level overview of exactly how individuals using their supplementary nutrition benefits and all the initiative we have with our partners to help them have a more healthier, a much eating environment. So are there any questions? Yes, sir.
People who on SSI, are they allowed to get SNAP benefits without having to constantly go through renewals?
Yes, they are. If a household is made up of individuals who are aged or disabled, a lot of those individuals only have SSI, Social Security Disability, we certify them for like 3 years. And we do that 3-year certification. We may send them a friendly reminder during the 12th month, letting them know if you have any changes in the thing, just contact us and let us know. They don't have to send anything in. Their benefits keep going at that level if nothing has changed. And we only contact them in their 22nd month and let them know it's time for a renewal if you want to see if everything's still the same, so we can certify you for another 36 months.
Okay, if somebody has a disability like blindness.
Yes, sir.
So they would, and they have hearing problems, or they can't hear, they can't see. You send them something in the mail, they can't read it. You call them, they can't hear you on the phone. How are they supposed to communicate with you guys that they?
If they don't have they don't recognize an authorized representative, someone can be there in their stead to take care of business for them. Normally, like we call, if they can't hear, we call and take everything over the phone and make sure we process their cases. If they can't hear, we have the TDT line that we can communicate with them. So we just don't let them just sit out there. We have to provide any type of service available to make sure that we're able to communicate with them, make sure we got everything correct and accurate, so we can make sure they exceed the right amount of benefits. So downscreen, it don't cause overpayment with them. We want them to get the maximum benefits they're entitled to. So we definitely use any option avenue available to us to make sure we reach out to them and make sure we can get a determination on the case.
Okay, as you probably know, Arkansas being the poorest state in the country per capita, we have a lot of people. We have a food insecurity problem, a huge food insecurity problem. You know, we 60% of almost 60% of the students in Arkansas receive free lunch. With so much food insecurity, why is people being disenrolled from SNAP benefits on such a high rate?
I'm not, to directly answer your question, if the individual been disenrolled and been found ineligible, it may be because due to the economy prospering, the minimum wage went up. We see a lot of people now working and they over the income limit. So that's why they're ineligible for SNAP benefits. If a lot of them, like I told you earlier, that normally our historic data show like 25% of our population do not return a renewal or recertification. They didn't even go for SNAP. So that's normally happen with those individuals who stop getting a SNAP. But eventually, like 10 to 15%, they come back in. Within a month or 2 months, they come back in with a new application and get redetermined. So we don't know what mitigating circumstances occurred that prevented them from continuing their benefits without a gap.
And SNAP renewals are every 3 months compared to Medicaid renewals?
It was every 12 months, but due to legislative rule, we had to start a 6-month cert in the month of September 2022. So they're all 6 months now, except that Pacific household I told you about. If everybody aged or disabled, we do them a 36 month, since that population is very vulnerable, and we just communicate them like every 12 months and see if everything is all right.
Okay. The issue came up last year in Pine Bluff, where Brookshire has closed down one of the stores.
Right.
And it created a food desert in Ward 1 of Pine Bluff, where there's no major pharmaceutical or grocery outlet where people can get their medications or go with SNAP to get their food and so forth. So there's just a few convenience stores which may or may not accept SNAP. And they usually don't have fresh vegetables or produce or anything like that. Is that something that DHS takes into consideration when they providing SNAP benefits to certain areas?
No, sir. SNAP benefits is federal regulated. We
Yeah, I
have to
know.
follow the regulations. So anywhere in the state and even in the other states in the country and the other state, they have to follow those basic federal regulations regarding eligibility. And so, no, just because of some communities, some counties probably don't have a large variety of stores that people can go and shop at. There are some, like Walmart and other stores. There are the basic stores there, but I think a lot of them, they travel to the nearest town. I know there's probably a problem with a lot of them. They probably don't have transportation or gas to do that. But I haven't heard of any big concerns or issue regarding it. Some cities, some counties not having sufficient stores where they can go and purchase their meal.
Well, I'll use one example, Earl, Arkansas.
Right, yeah. Mm-hmm.
Are you familiar with
Yeah,
it?
I am.
A young man was in high school. He ended up getting elected mayor on one promise, to bring a grocery store to Earl, Arkansas.
Mm-hmm.
Because they have such a huge food insecurity problem. Has anyone at DHS contacted the mayor of Earl, Arkansas, the 18-year-old, 19-year-old mayor of Earl, Arkansas, to say, how can we help?
No, I can't say we have. Can't say we have. Can't say that community organizations haven't got with them. Chamber of Commerce haven't got with them and try to secure their town and get some type of other store there, so they don't have to travel to Forest City or another place huge and get benefits. So no, I can't say that.
I just have one question. It may, I know that you're talking about SNAP, but this may not be related to your department. But during the pandemic, you had most of the school districts, the students received free lunch and free breakfast and all of that. I think they said due to a grant. I'm not sure what the grant is. Can you tell what the difference is for this year? Because you have some districts that say, families that are in some districts, they say, oh yeah, we're still receiving the free lunch and free breakfast at our school.
Right.
But as for like my child in his district, they don't do that. You have to go back to the old to see if you require, to see if you meet the qualifications to do that.
Right.
Can you tell what's the difference in the districts, you know, if they're all central, Pulaski County, Little Rock, North Little Rock, of why is it that some districts may still be receiving
Right.
the funds for the kids to receive free lunch all the way around, and in some districts where the students are not?
Right. It all depends upon the school system in the various counties. They make that determination if they want to allow that to continue or not. So it's the same with the PBT cards during the summer and stuff. A lot of them want to participate and a lot of didn't. So it's all tied in with the Department of Education and what the community decide, yes, we're going to do this, and others who decide not to do it.
So I have a question about the food stamps during the pandemic. Why were the homeschooled children not allowed to receive the additional food stamps, as their money goes to the school district just as well as if a child attends the school?
You said additional food stamp. Even though they homeschooled, if they homeschooled and that household applied for food stamps and got approved, and there was a surplus of additional food stamps, you get the maximum benefits during the pandemic, they weren't deprived of that. They got that as well.
No, if there was people in the community, I don't know, it was going around that kids from the school were getting food stamps in Jonesboro, like from different school communities and stuff. But if your kids were homeschooled, it was stated that you were not allowed to get those additional food stamps.
Not on additional food stamp.
Yeah.
I'm sorry. Yeah, there was regarding that. Yeah, like I go back to this other young lady question. It all depends upon the school system at that county. Did they adapt that? Did they want to incorporate that and provide that service to the citizen of their town and the students that goes to their school? So it all depends upon the individual
that was
county.
basically through the school system,
Yes,
not through the Department of Human Services.
Right, correct.
Okay, because I was wondering, to me, that seemed just kind of odd that,
Correct.
to segregate, that part of the community like that. So.
My question is about the frontline workers during recertification of SNAP. It turns out every time I have to recertify, every 6 months when I have to recertify for SNAP, for some reason or another, during this past snowstorm, I wasn't able to get out and submit my recertification application. So there was a change to where it was made automatic, and if my application wasn't received by the deadline, it was automatically canceled. So I have a child that has special dietary needs, and because her milk is like a special diet, it's not provided through WIC, and I'm being left with income gaps as to how to provide her diet needs, because I'm going 1 and 2 months without any SNAP benefits, even though I qualify for an expedited application.
Right.
Well, I received my appointment letter in the afternoon of the morning when I was supposed to have my appointment.
Okay.
So now I went all through March without any SNAP benefits. And it's supposed to be an expedited application. Well, that doesn't differ from the process of how any other application is being processed. And why have the benefits for SNAP and the other programs like Medicaid and the insurance programs, why have they gone away from having a case manager as a focal point where they would kind of be a navigator and help you kind of navigate and help you, like, even before, I think they used to have like an emergency, like for people like me that have no income, that needed emergency benefits. I think they used to provide that in the past, but now we're being left with like income gaps, and we're having to find other ways to make up for that.
Okay, you alluded to it earlier when you said expedited services. That's the
Expedited
emergency.
application.
So normally expedited service, we waive a lot of verification. Only thing we want to verify is that your identity and your state of Arkansas. So we'll certify you for 1 month so we can give you access to buy food right away. We'll do that while we go through the process of verifying the essential components that we need. So if you wasn't approved for that 1 month, and then interview, I'm gonna give you my card. I need to talk to you and see exactly. Can we look at your case and see what's the status of it?
That happens every time, recertification. I'm being left with sometimes up to 3 months with no SNAP benefits.
Okay. Have you created an account online to do your?
I have, but it's not user friendly, and I've never been able to navigate it.
Okay, gotcha. Okay. Have you ever been up to the county office?
Every time I call, they never answer in Benton County. And when I go, they always tell me to either call the number, submit my paperwork through the website. I've even talked to a manager once who told me he was going to reopen my case. Turns out I come in a week later and nothing was done.
Okay, well, give me that, because you got email address. We can email you that. We can email you that form. You can fill it, email it back to us.
Right.
So if you can fax it to us, we have it. So I'm gonna give you my card so you can give me information.
All right, we're just about at time. Thank you, Robert, for that presentation. And let me remind you before we wrap that these council meetings are, we need ideas from you for agenda items. A lot of the ideas do come from leadership because there's programs or things going on that they think you need to know about or should know about. But if you have any suggestions on ideas for future topics, the sooner you get them to me, the sooner I can work with DHS leadership and find the best person to be here at our meetings to address whatever topic you suggest. So you guys all have my email. I'm going to email you out some information based on what was shared here in the meeting. I don't know if you guys see, but I saw the secretary taking notes. I saw Janet taking notes. They are absorbing some of the suggestions and ideas that you have, and we'll see where that goes. But that's what our job is this council is an advisory council to the DHS leadership. So the more advice you can offer, the better. So we appreciate your time and attendance. Be sure to leave your mileage forms. And we will see you at the, May meeting. Drive safely. Thank you.